We'll now begin the push-up section. Ready? Begin. Down, up, 1, down, up, 2, down, up, 3, down, up, 4, down, up, 5, down, up, 6, down, up, 7, down, up, 8, down, up, 9, down.
This test is performed until the student can no longer keep up.
Thank you very much. Pleasure to be here. I'm the Associate Executive Director for Population Studies down at the Pennington Biomedical Research Center. The primary goal of our report card is to assess the level of physical activity and sedentary behaviors in our children. As well, we want to look at the facilitators and the impediments to why they're physically inactive or why they're being physically active. These are very important things. We want to look at the environment. So the theme of this year's report card is plug into play. The last 3 years, I'm sure you're aware, we've seen some very exciting developments in the field of physical activity and health. 50 years of research, 50 years of epidemiological research and science led to the 2008 Physical Activity Guidelines for Americans. This was released in 2008. It's a federal guideline on the amount of physical activity that children and adults need to attain optimal health. So this was a huge landmark event in 2008. Earlier this year, President Barack Obama created the White House Task Force on Childhood Obesity, and I'm sure many of you are aware of the First Lady's project, which is Let's Move. And her goal is to end childhood obesity in 1 generation. So these initiatives focus on creating healthy environments for children and empowering children to become more physically active and to adopt healthier diets. So within this framework, the Pennington Biomedical Research Center, our mission is to promote healthier lives through research and education in nutrition and preventive medicine. And it's been that way since we opened our doors 22 years ago. So this legacy of nutrition and preventive medicine research kind of puts us in a good place to begin translating the research we do in the lab into real-world improvements in children's health. Now, this year's report card was developed by 2 different committees. Our first committee was an advisory committee made up of people from across the state. These were individuals from various organizations, various stakeholder groups. Their job was to just guide us in the overall direction of the report card. The second group was our research committee. This was made up of scientists who were involved in children's health research. And their job was to identify the indicators where we should be looking and come together on assigning the grades that you're going to see. So these 2 committees really were convened to develop this report card this year. So now, I would like to turn to this year's results. I should note, as usual, we have 2 versions of the report card. We have a short executive summary version, which provides the grades and provides some of the data behind where we are today. Now, I think a more important document for those that want to read it is our evidence document. Now this just provides the evidence behind all of the grades. It provides all the data for Louisiana on why we're giving certain grades to these indicators. So this year, Louisiana received a grade of D, again for the 3rd year in a row, for children's health and physical activity. This grade has been unimproved from 2008 and 2009. And the grade indicates that there are insufficient physical activity opportunities and programs available for the majority of children in Louisiana. Just to contrast, a grade of A, had we assigned a grade of A, it would have meant that the majority of Louisiana's children and youth are physically active and are obtaining optimal health. So this overall grade of D was assigned based on a number of different indicators from 5 different domains. Now I'd just like to provide just a little bit of background on a couple of the indicators that informed to this grade. Now it's particularly appropriate that we're issuing this report card in September. as President Barack Obama this year has designated September as National Childhood Obesity Awareness Month. And nowhere is the problem of our child's health more visible in Louisiana than in this indicator of overweight and obesity. Right now in this state, 48% of our children are overweight or obese. Almost half of the kids in Louisiana are overweight or obese. 30% of the children are clinically obese. So unfortunately this year, for the third year in a row, we had to give a grade of F on the overweight and obesity prevalence. It's one of the highest in the nation, and we need to take this very seriously. So the theme of this year's report card, as I said, is plug into play. We need to unplug our children from all the sedentary behavior and all the television viewing which is going on. Right now, the American Academy of Pediatrics recommends that children and youth watch no more than 2 hours of television each day. No more than 2 hours a day of television. And the most recent data from Louisiana show that 58% of our children are exceeding that threshold. And many of them, 10 to 15%, are watching more than 4 hours of television every day. I mean, CSI isn't even on that much. Almost. Now, the report card really has become an advocacy tool for educating the public, shining the light on the poor health of our children right now. And in order for us to focus, we need to become aware of the steps we can take to improve the grade. So as individuals, as parents, as teachers, as individual community members, and as voters, we can make a difference. We need to create environments where our children can remain physically active and can undertake an active lifestyle. So in this respect, the report card really is a success. Pennington wanted to highlight today a school and a parish that is a leader in physical education, and we've come to North Highlands Elementary because of the outstanding programs that we've heard about. Today we're announcing the results of our third annual report card on physical activity and health for Louisiana's children and youth. This year we received a grade of D for the third year in a row. It really means that there are inadequate opportunities for our children to be physically active in the community, in their home, in the environment in general.
And what are the recommendations of your report?
Well, we have many recommendations this year designed to engage teachers, physicians, nurses, parents, and policymakers in the problem and try to find solutions where we can now change our environment so that kids can be more active.
After 3 years in a row, what does it tell you about the nature of the health of Louisiana's children and what needs to be done?
Well, these results are very consistent from year to year. We've had a grade of D every year for the last 3 years. And really, these things are hard to move. When you're looking at outcomes such as obesity, physical activity, these are things that take a while to move in the community. You're not going to wake up tomorrow and see that all of our kids are active and not obese anymore.
Tell us what your recommendations are.
Well, we recommend a number of things from policy angles. We need government and non-government organizations to work together to attack this problem. The American Academy of Pediatrics recommends no more than 2 hours of television viewing per day in children and youth. So we recommend that that be the maximum amount that children are allowed to watch. So if parents can establish rules in the household around television viewing, that can go a long way. One other thing we noticed from the data really is that children who have a television in their bedroom are more apt to become overweight and obese. So we're actually asking parents to try to get the TVs out of the children's bedrooms.
Very good. What's your conclusion as far as what you've seen here and your recommendations that, what Louisiana needs to do as a state and what parents need to do individually?
Well, that's a tough question. The entire country is engaged in this effort. Louisiana is no different than the other states. And it's going to take a concerted effort from all levels of government, non-government organizations, parents, teachers, and the voters to make a change. We can't lay blame in one jurisdiction versus another. We really need to work together to get solutions that will be right across the board.
If people have questions or would like more information about the report, what should they do?
Well, they could email us at the Pennington Biomedical Research Center, and the report card will be posted at louisianareportcard.org.